So today I'm going to go over immunity and the skin. I'm going to cover as much as I can on that. We should be able to get through all of it. I'm just going to start right from the beginning with immunity because you do have to know this. All right. So there's two types of immunity, humoral or cell mediated. And we'll get into those as we go through that immune system. Your immune system are cells that start to fight off any sort of pathogens, viruses, fungus, anything like that that enters the body. And you have a couple different barriers that prevent you. And these are called lines of defense. So these hopefully help you from getting any sort of infection or having any sort of issue. But in some people, these barriers either aren't working that great, they're interrupted for some reason. They may be taking drugs that have them immunosuppressed. They may have diseases that cause them to be immunosuppressed. So in that case, sometimes these defenses don't work for one reason or another. So the first line of defense, and you have to know these, okay? Your first line of defense is going to be your physical and chemical barriers. So that's like the skin, the mucous membranes, your tears, your saliva. All these are supposed to prevent any pathogens from entering the body. Your second line of defense is non-specific also. So what does it mean? Specific versus non-specific. Non-specific doesn't require any sort of prior exposure. So whenever your body performs a non-specific defense or response to any pathogen, virus, or anything that's entering that body, it doesn't have to have previous exposure for that to happen. Your third line of defense is a specific response, and that requires the production of antibodies, which come from your B cells, and activation of both your T and B lymphocytes. And those are going to help the body attack specific antigens. So that's known as your adaptive response. You're actually born with an innate and an adaptive response. So your innate is what you naturally have that will help you kill any sort of bacteria or any sort of damaging agent that could enter your body. All right, so we have two non-specific responses and one specific response. Okay, so can you please put yourself on mute?
Swelling and fatigue, and it's just 4 doses a year after 2 starter doses. Don't use serious allergic reactions, increased infections, or lower ability to fight that may
Miss
occur.
Roberts, I'm going to remove you from the lesson if you don't put yourself on mute. Okay, if you're coming on the session, I'm recording and I need you to please be on mute unless you're engaging. Thank you. All right, so the body has these defense systems, the non-specific and the specific response. Okay, non-specific involves phagocytosis, inflammation, your skin, your tears. Specific is going to be that production of antibodies. And this is something you have to know. In that non-specific immune response, there's mast cells there. They're going to detect some sort of injury or some sort of bacteria entering the body. Okay. And as a result, it's going to start to release histamine, and that will start the inflammatory response. Histamine will bring everything to that site. So let's say you sprained your ankle and you have an injury there. That histamine is going to be released. Okay. It's going to go to the site where that injury is, and it's going to bring blood flow there. Okay. And that blood flow is going to allow other things to come there. So the vessels are going to become more impermeable. They're going to open up, be wider, and allow things through. Okay. So now we have all this blood flow coming in there, and that blood flow is going to cause that area to swell, become red, warm, and painful. So it's not just histamine. There's other things that are going to be released. Okay. But right now we're just talking about the histamine. And as we go into this lecture, we'll talk a little bit more about some of that other stuff that is going to be released. All right. So your first line of defense is your skin, the tears, the mucus. Second line of defense is this immune response that I just talked about, which is initiated by the entry of either a pathogen or an injury into the area. You have that release of histamine. That's going to bring cells to the area, like macrophages, natural killer cells, monocytes, neutrophils. These will destroy the pathogens that are there. Or if it's an injury, okay, it's going to start that inflammation process so that it can wall off the injury and limit it to that area. Inflammation, fever, histamine, complement proteins are all non-specific immune responses for that second line of defense. So now, before we talked about an injury, now we're talking about pathogens. When pathogens enter the body, that's when your immunity is going to kick in. All right. But both of them, whether it's an injury or pathogen, would trigger that inflammatory response. Cytotoxic T cells, helper T cells, and B cells are the three types of lymphocytes that trigger an immune response. These cells would generate either humoral or cell mediated immunity. A specific immune response is an immune response against a specific antigen, and that's the third line of defense. So your third line of defense is typically going to involve antibodies, and those antibodies are going to be produced from your B cells. B cells will mature in the red blood in the bone marrow. Okay, and so those are the things that you really have to know. You have humoral or cell mediated immunity. Humoral is going to be your B cells. Um, Cell mediated is your T cells. So just so you understand this a little bit better, I talked about it a second ago, but I'm going to go into it now so that you really understand it. Your innate immunity is what you're born with, and that protects you from certain things. Okay. And it also is your first and second line of defense. So, first line of defense, your skin, your saliva, your tears, your mucus. Second line of defense, phagocytosis, macrophages, inflammation. Your innate immunity is local, it targets pathogens at the site of invasion. Fever is an exception. With fever, that's a systemic effect throughout the body. With innate immunity, it's non-specific, meaning that it doesn't have to have a previous exposure for it to work, and it's not going to just work against one particular pathogen. It works against everything that it encounters. With innate immunity, there is no memory, no prior exposure. So it's not as easy, maybe sometimes, for it to defeat that pathogen like the other one, because with the other one, we'll talk about how your first time exposure is just small, but the second time your body's exposed to that and something like chickenpox, you have this huge response. So that kind of helps it to defeat that pathogen or whatever's trying to enter the body. With adaptive, that is your third line of defense. It has memory in its favor, again, because when the body is exposed to a specific antigen the first time, it will develop a few antibodies. Second time, it's going to develop a whole army of antibodies. And when it develops that whole army of antibodies, it's going to try to knock it out. Okay. So, really, when they test you, when you go, all of you had to get either immunizations or you had to get titers for school, right?
Yeah.
Yes.
Yes.
So, what are those titers telling you?
That you're immune to it.
Yes, that you have that immunity. So when you were given the vaccination, your body developed those antibodies, okay? Which most of the time you're going to have them for a lifetime. And those antibodies, this is that specific response that we're talking about. So you got a Hep B vaccination, you built antibodies to not be able to catch Hep B. If you got the zoster vaccination, then you developed antibodies so that you wouldn't develop chickenpox, or maybe you got the one for shingles so that you wouldn't develop that. So adaptive immunity has systemic effects. It acts throughout the body trying to defeat the pathogen wherever it is. It has specificity, meaning that it's directed exactly against a specific antigen. Okay, so it's either going to be something like chickenpox, all right, or Hep B. Adaptive immunity has memory. So whenever you're re-exposed to the same antigen over and over, the body is going to react more quickly, more efficiency. These are just a couple of the cells that you have in the body, okay? And the immune system can directly destroy cells through T cells, which mature in the thymus. So at about the age of 14, your thymus stops growing. And at that point, you've developed all of these T cells that you need in your body in order for you to fight things off. The immune system has a lot of different cells. They all have different functions. It stops the body from becoming infected by pathogens through physical or chemical barriers like the skin or stomach acids or enzymes that are found in the different cells. Neutrophils have the ability to kill bacteria and fungus, where eosinophils will typically kill more parasites or cancerous cells. Lymphocytes can attack viruses and have a role in antibody production, hence your B lymphocytes, okay? And mast cells and natural killer cells invade bacterial infections and tumors. So they all have different things that they can do in the body in response to things that are entering it. Your plasma cells or your B cells make the antibodies, and they produce those antibodies to attack those antigens. You also have a lymph system, okay? That's part of your immune system. So you have lymph nodes, the spleen, the tonsils, intestinal lymph tissue, lymphatic circulation. This is helping to remove bacteria and foreign objects that are in that system. So that's what your lymph system does. It also returns, things like extra interstitial tissue back to the blood, okay? But it's removing any sort of foreign material or any sort of
Oh, Lima,
bacteria.
you didn't leave yet.
Excuse me.
You said-
Excuse me. Can you please put yourself on mute? All right. The lymph circulation and that forms the basic structure in that the immune response can function in. So all of these things are going to try to capture any sort of foreign material, like your tonsils. Whenever you eat, okay, they'll grab the stuff off the fork or the bacteria that's in the mouth. In the intestines, the body's going to try to remove additional foreign bacteria that's in any foods that you ate. In your lymph circulation, that plasma that's going back, it's going to try to pull out any sort of foreign material or bacteria that's in there. Your spleen is going to try to remove bacteria. So all these things are going to work together. And then you have immune cells, lymphocytes, and macrophages, and those help also to identify and remove any foreign material. Tissues that provide immune cell production develop in the bone marrow and the thymus. The immune cells will originate either in the bone marrow. The bone marrow and the thymus then will have roles to mature those cells, and that can happen during fetal development. Eventually, it'll go into you as adulthood. So in the thymus, those um, the T cells are going to start to develop, and in the spleen, your red blood cells will start to develop when you're a baby. But as you grow, those T cells and come into life, okay, because sometimes this is happening in utero. So as you're born and you start to grow, that thymus will start to mature those T cells, and the B cells will go into the bone marrow instead of the spleen. And that's where they'll mature at. There's also chemical mediators that the body produces, histamines and interleukins. Okay. Histamine, I already told you, is a vasodilator, so that's going to help with the inflammatory process. The interleukins, they help with fighting things like viruses. The body can also attack itself. So you already know that it does that in autoimmune disorders. The blood and the circulation system are the transportation and communication system for the immune system. So just some structures here, okay, that you would want to be familiar with. Your thymus, your spleen, your lymph nodes. Okay, Peyer's patches, that's the in the intestines. Okay, that's the immune system and the immunity that it's talking about in the intestines. You'll learn about that a little bit more when we talk about GI. Okay, and then the two main cells are on here, the B cells and the T cells. The B cells are going to make those antibodies. Okay, and the T cells will help destroy infected cells. Antigens are anything foreign. Self antigens or HLA, these are your individual type of antigens that you have in the body, and they're unique in everybody except identical twins. This is important if you ever had to have like some sort of a transplant, because if we had to do a transplant in your body, we would want to know that the donor that you have, that those self antigens are somewhere close to yours. So if you were getting it from an identical twin, you probably wouldn't have much of a problem. But if you had to get an organ or some sort of transplant from somebody else, if their antigens aren't close to what yours are, your body's going to reject it. So this is why they're talking about the antigens. And the other reason is because your body has certain antigens, self antigens. These are called HLA proteins. And this is what your body produces. Okay. And it's what makes you unique. These are inherited from your parents, and they help make up what we call the major histocompatibility complex. And they use this again whenever there's going to be any sort of a transplant. But people that have autoimmune disorders, their body is not able to detect self versus non-self. Now, most people, their body is able to detect anytime an antigen enters it, and it's different from their own system. So this is why if a transplant were given and it's different, the body's going to recognize it as non-self. If you develop some sort of disease like chickenpox, or you're exposed to it, your body's going to recognize it as non-self. So the immune system is going to immediately start to build a response to it and try to attack it. All right. So self antigens are what we inherit from our parents, and they sort of make up who we are. And our own immune system will ignore, or should ignore, our self cells. In people with autoimmune disorders, that doesn't always work. In non-self antigens or non-self, the body should recognize those and mount a response to it. Antigens are just chemical markers that are located throughout the body, and they help identify cells or molecules. They'll induce an immune response on the part of the host. Sometimes antigens can be part of the host itself. So when we talk about the major histocompatibility complex antigens, or the human leukocyte or HLA antigens, those are genetically determined in your body. The major histocompatibility complex antigens are all tolerated by your body's immune system. Anything foreign would be destroyed. So if you don't remember anything else out of that, just remember that your self antigens, those are your HLA or your human leukocyte antigens. Those make up your major histocompatibility complex, and those are tolerated by your body. Okay. Other ones would not be. Macrophages are essential in initiation of the immune response. They come from monocytes, and they're present in the body in areas like the tissue, the liver, the lungs, the lymph nodes. They're large and they're able to intercept and eat up foreign material. They're like Pac-Man. You know that game Pac-Man. So they come along, chomp, 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 and they eat up the foreign material. And then they'll take that foreign material and they'll display it on the membrane of the cell, and it's known as an antigen when it's displayed on the outside of that cell. So the macrophages don't actually totally destroy it. They mark that cell for destruction, okay, by displaying that antigen on the cells, and that will pull the other white blood cells to that cell to actually destroy it. So it initiates that immune response by tagging the cell for destruction.
I'm sorry, Professor Loesch, I'm just trying to envision this. So when I picture Pac-Man, I picture him engulfing like the ghost. So when you say macrophages mark the cell, are you saying that it engulfs it and spits it back out?
So I'm not quite sure because, they don't really break it down like that. It just says that they engulf the foreign material, then they process it. So they must be pushing it back out in some manner. Okay.
Okay.
And putting it on the outside of the cell. And when they put it out on the outside of the cell, it's like a giant billboard that says to the white blood cells, come and destroy me. I don't belong here. So your body works a lot off of like metabolic processes, right? So it breaks down things. And when it breaks down things, it releases sometimes certain enzymes and stuff. So that may be what they're talking about here without going into it too deep. What you really have to know is that the macrophages will engulf the material and then stick it onto the outside of the cell to mark it for destruction. And that initiates the immune response. That's the final piece of that you have to know. So it says also that the macrophages secrete chemicals like monokines, interleukins that help to activate other lymphocytes in the inflammatory response, and that accompanies a secondary immune response. So again, you may imagine here that once they engulf the material, because they're saying they put pieces of it, they must secrete something out that they're tagging this cell with. Okay.
Okay.
The primary cell in the immune response is the lymphocyte, one of the leukocytes or the white blood cells produced by the bone marrow. Immunocompetent cells are mature lymphocytes. These have a special function of recognizing and reacting with antigens in the body. The two groups of lymphocytes are B lymphocytes and T lymphocytes, and they determine the type of immunity initiated. And remember, that's either going to be cell mediated, which are your T cells, or humoral, which are your B cells. Humoral is antibodies. T lymphocytes come from the stem cells and they're held in the bone marrow and then they go to the thymus where they develop. Cell-mediated immunity occurs when the T lymphocytes recognize antigens on the surface of the target cell and directly destroys the invading antigen. These specifically programmed T cells will reproduce and create an army to battle the invader. They'll also activate other T and B lymphocytes. T cells are mostly effective against virus-infected cells, funguses, protozoas, cancers, or foreign cells. So a lot of that they may not ask you about, all right, but it's in your lecture, so I'm telling you about it. What would I really want to know here? Those T lymphocytes, they're for what sort of immunity?
So,
Cell-mediated. Okay? Keep saying it. T cells are cell-mediated. B are humoral. Okay? And B involves antibody production. Cell-mediated involves your cytotoxic T cells, your helper T cells, which is your main immune system, okay? And your memory T cells. So the cell-mediated immunity from those T cells recognizes the antigens on the surface of the target cells and they start to destroy them. They'll also create an army, activate other T and B cells, okay, to come to that area and help. Cytotoxic CD8 positive T killer cells destroy the target cell by binding to the antigen and releasing enzymes or chemicals to destroy it. They can also cause an inflammatory response, which attracts macrophages to the site to stimulate the growth of more lymphocytes and stimulate hematopoiesis. Phagocytic cells will then come along and clean it up. Helper CD4 positive T cells facilitate the immune response. The memory T cells remain in the lymph nodes for years, ready to activate the response again if the same invader returns. Two subgroups of T cells have gained prominence as markers in people with AIDS. T helper cells have CD4 molecules as receptors on the cell membrane, and the killer T cells have CD8 molecules. These are important in T cell activation. T helper cells have CD4 molecules. CD8 killer T cells have CD8 molecules. All right. CD8 positive killer cells are cytotoxic, where CD4 positive T cells regulate the cells in the immune system. The B and T lymphocytes, the macrophages, the natural killer cells will secrete the messenger cytokines. Those cytokines are going to cause chemostasis and pull things to the site to help fight the bacteria or help fight the disease. In AIDS, okay, what you need to know here is in AIDS, the CD4 cells are destroyed. When those CD4 cells drop below 200, the person has AIDS. The rate of CD4 to CD8 should be 2-1. But in HIV, the CD4 positive cells are destroyed, and that cripples the entire immune system. And this is why people with AIDS end up getting opportunistic infections, because their body doesn't have the ability to fight. So what do you need to know here again? You need to know that your T cells are for cell-mediated. It involves your cytotoxic T killer cells, which are going to destroy that antigen when exposed. Your helper T cells, which promote your immune system. You also need to know that in AIDS, those CD4 cells are destroyed, and that cripples the immune system. So usually that CD4 ratio is dropped down below 200. You have less than 200 of those in your body, okay? They need to be up above 400, really, for your body to be able to fight disease or to fight off those opportunistic infections. So an opportunistic infection means these are infections that you wouldn't normally get. Your body would normally fight them off. In someone with AIDS or severe immunodeficiency disorders, they do not have that ability. Also, someone without a spleen cannot fight infections. So if they don't have a spleen and they have a temperature of 1 degree or more, you better be on that phone to the doctor. B lymphocytes are responsible for production of antibodies. They are responsible for humoral immunity, and that's done through the production of antibodies or immunoglobulins. B cells mature in the bone marrow, and then they go to the spleen and the lymphoid tissue. After they're exposed to an antigen with the assistance of a T lymphocyte, the B cells will produce these plasma cells, and these plasma cells produce antibodies. Natural killer cells are lymphocytes, distinct from the T and B lymphocytes. They can destroy without any prior exposure or sensitization. So you have a number of chemical mediators like histamine and cytokines that are involved in that immune response, unique antigens and proteins in the cell that the immune system can distinguish from self or non-self. The immune system typically ignores those self cells and it will target the non-self cells. It's similar to a surveillance system that warns the body of an attack, then sends out an army to fight off. And the lymphoid tissue in places like your tonsils, your throat, your adenoids, these can all help with that immune response, as well as that lymph circulation, your lymph nodes. All that is helping you fight. The chemicals that are released, like the histamine and the cytokine, these actually send out signals. And those signals tell the body what to do when this is happening. Now, in COVID, a lot of people died, and they died because the infection in their body went crazy. They had a hyper response. A cytokine storm is triggered whenever someone has an infection like H1N1 or COVID, and the body starts to respond. But instead of it having a normal physiological response, it has an exaggerated or an uncontrolled response, and it releases too many cytokines, and it causes a cytokine storm. And because of that storm, it causes the person to go into acute respiratory distress. So a lot of people that died from COVID died because of that cytokine storm. All right, so humoral immunity. Here, your antibodies are produced to protect the body, and in cell-mediated, your T lymphocytes are programmed to attack non-self cells and protect the body. In humoral immunity, the host defense is mediated by antibodies present in the plasma, the lymph, and the tissue. And in cellular immunity, the host defenses are mediated by the T cells and non-specific cells of the immune response. So again, cell-mediated involves T cells. A T cell response will occur when the cytotoxic T cells attack the altered cell. The helper T cells will join in and attack, and so do the memory T cells. And then they'll retain knowledge of that pathogen for future encounters. With humoral immunity, that is B cells, but the T cells can help it. Okay, and in humoral, the B cells are going to help produce antibodies, those plasma cells. Any questions on any of that? All right, antibodies and immunoglobulins. So antibodies are also called immunoglobulins. IgG or gamma globulins are glycoproteins, and those are produced by the plasma cells in response to a foreign antigen. So again, this comes from your B cells. IgG, how many of you have ever taken care of anybody who's gotten IgG infusions? They have to get them. Some people don't make IgG, or they don't make enough of it to fight. So they have to get infusions, and typically they're monthly. They are working on some other ways of boosting this for people because it's uncomfortable. And when they get the infusions, they can experience a lot of different stuff while they're getting it, reactions in the body, because we're introducing immunoglobulins in the body. Antibodies do not destroy foreign antigens themselves. They become attached to the antigen and label them for destruction. So that's all done through that macrophage process. Each antibody is specific for only one antigen, and B cells can produce millions of different antibodies. But there's 5 classes of human antibodies. Those are IgG. That's the most common in blood. IgA. This will be in your secretions, your tears, your saliva, in mom's colostrum when she starts to breastfeed, and IgM, which is the first to increase in the immune response. You also have IgD and IgE. They'll probably ask you a lot about IgE. IgE is always going to be seen in allergic responses, releases of histamine and other chemicals. So anaphylaxis, any sort of allergic response, you're going to see that IgE. Antibodies can also neutralize viruses. They can attach to the virus and stop it from being able to enter a cell. The virus is not able to reproduce if it can't enter the cell. Antibodies are part of the allergic response. Whenever the immune system responds to a foreign antigen like plant pollen, okay, IgE antibodies are going to be produced there. Those IgE antibodies will cause the body to break down the mast cells and release histamine. So again, whenever histamine's released and other chemicals, we're going to see inflammation. But what else with that histamine? We'll see like an itchy throat, sneezing, watery eyes. With anaphylactic shock, this is an allergic reaction, but it's just going to give a massive response in the body. So this is going to cause loss of plasma from the capillaries, an effective histamine, a sudden drop in the blood volume because it's a vasodilator, and a sudden drop in the blood pressure. And actually, they can go into cardiac arrest from this. Antibodies are a special class of proteins called immunoglobulins. Each immunoglobulin or antibody has a unique sequence of amino acids that helps it bind to the antigens and attach to the macrophages. Specific immunoglobulins can be administered to treat certain diseases like Guillain-Barré, which is an autoimmune disease. The complement system is activated during the immune response with IgG or IgM. And complement involves a group of inactive proteins that will circulate in the blood. Activation of the complement system usually results in destruction of the antigen by lysis when the cell membrane is damaged or some fragment attaches to the microorganism to mark it for destruction. The complement activation also helps to initiate that inflammatory response. With IgG, also known as gamma globulin, this is the main immunoglobulin in blood, lymph, cerebrospinal fluid, perineal fluid, and it is able to cross the placental barrier. So this is what gives you passive immunity at birth. Comes from your mom, okay? IgM is an antibody made by B cells. And this is usually produced whenever you develop a new infection.
Professor Loach, you're still on IgE and IgD on the screen. That's what we can see.
Yep, and I'm still on that slide. That's where I'm at.
Okay.
IgA is going to be in the tears, the saliva, the mucous membrane, and the colostrum. So it provides protection for the newborn. IgE is a vital part of the immune system. Again, I would know this. With IgE, we'll see that in any type 1 hypersensitivity reaction in response to an allergen. IgE antibodies will be released, and it comes from the histamine, from the immune cells. And again, we're going to have symptoms like runny nose, swollen, itchy eyes, a rash, or even anaphylaxis. So this slide's a little bit hard to see, but this is in your book, okay? And it's just telling you what some of the different things do that are in the body. It kind of breaks it down a little bit simple. But just think about how much you'd be willing to pay a security system to protect you for 24 hours a day, 365 days a year. And that's what your immune system is doing. If you have antibodies that provide immunity, then it's going to be called antibody mediated immunity or humoral immunity. And that is a specific defense in the body. The other is cell mediated immunity. And this is where your T cells are providing immunity, getting rid of unwanted cells in the body. Okay. So you have to know the difference between those, humoral versus cell mediated, and what does what. What do each one of these things do? Your complement system is activated during the immune response with either IgG or IgM. This causes proteins, okay, to circulate in the blood. This group of inactive proteins is then activated, and it'll stimulate the release of other chemical mediators to promote things like inflammation, chemostasis, which is where the cells are signaling other cells to come to the area, phagocytosis. The complement system is frequently activated during an immune reaction with either IgG or IgM. Think of an army trying to protect and defend a territory. The enemy spotted in the territory and the army comes in. That's your complement system. These proteins will be circulating and activating in the body, and they're going to help destroy any bacteria or any virus that has tried to enter that area. And the proteins are named according to their time of discovery. You don't have to know all that, okay? C1 to C9. I haven't seen ever any questions on that. A number of chemical mediators like histamine and cytokines are involved in the immune response. So this kind of stuff I would know. What does histamine do? It's released from the mast and the basophils. It causes vasodilation, increased permeability, or edema. Mostly we'll see this in allergic reactions. It dilates the blood vessels. Okay, so that can cause the blood pressure to drop. It can cause blood to leak out. As the allergens enter the body, they're recognized by IgE. So in allergic reactions, we're going to see IgE. And that would be present on the B cell specific for that allergen. That's going to produce a plasma cell, a memory cell. So anytime the body's exposed, that's going to cause that reaction to occur. And why do they have anaphylaxis? Because sometimes it's a really exaggerated reaction. You might not see it in the beginning. Like even if someone's taking antibiotics, they might not have a reaction right away. It might take a few days. They can also go into anaphylaxis and you can treat it and they can go back into it again because the treatment might not be as strong as the actual reaction. Anytime that allergen enters the body the second time, the IgE present on the surface of the mast and the basophil cell is going to bind with the allergen. And that's going to cause the basal cell to break down, the mast cell to break down and release that histamine. And again, the histamine is responsible for those symptoms. Other chemicals that are released is leukotriene and cytokines. That causes the allergic reaction. The histamine is released into the lungs. It can cause wheezing, the nose, causing nasal secretions, sneezing, itching. Cytokines are chemical messengers. And this includes your lymphokines, your monokines, your interferons, and your interleukins. And they're produced through macrophages and activated T cells. And they stimulate and activate the growth of both B and T cells. They help communication between the cells. They're involved whenever you see an inflammatory response, fever, or leukocytosis. So an example is if you ever twisted your ankle and it became swollen, if you ever had a cut that became infected, then your body produced cytokines that caused it to have that response. They're called messenger cells because they take that message and spread it throughout the body. And once they attach to the cell's surface receptor, the cytokines give the cell the message. So it gives the cells the message to increase the inflammation and the pain to an area of the body, like when you sprain your ankle. It sends that message down there for that inflammation and that pain to occur. Cytokines are small, non-structural proteins. They're secreted by certain cells in the body. They help regulate the inflammatory and immune response. And they're also immune cells that protect the body from pathogens and infections. All right, so we already talked about self versus non-self. Any question on that? Types of immunity, you should know the differences between these. Okay. Active immunity is when your body develops antibodies in response to an antigen. Active natural immunity is when you have direct exposure to an antigen. So, like you have an infection and then you develop antibodies because of that infection. Active artificial is when you get the antibodies introduced, like in a vaccine. Passive natural, I already talked about that. That's when, like, your mom gives you the IgG at birth. And passive artificial would be like if you had a snake bite or if you had a rabies infection and I gave you a serum. That would be passive artificial. I would know that. And then innate immunity, we talked about. Okay, you get that at birth. Again, you're going to have a primary exposure to an antigen. That's your primary response 1 to 2 weeks before the antibody titer reaches its actual level where it can start to fight. Second response, a big army comes out, and it's going to happen quick. Any questions on these? Active, natural. So here, your sister has chickenpox, you're exposed, you develop antibodies. Active, artificial. You go down to the clinic, you get the vaccination for Hep B. Passive, natural. IgG from your mom. That's temporary. Passive artificial injection of those serums, like for rabies or a snake bite. All right, so why do we give vaccinations? Because it helps to decrease infections. It can provide immunity for the majority of the population. It can prevent outbreaks. We have to watch for emerging and re-emerging diseases. Right now, like the measles, that's coming back out. And we have some other new diseases that are coming out, okay, that we haven't seen before. So we're constantly surveying for that, and we have to be careful with it. Again, we don't know what direction healthcare is going to go in right now because there's a lot of nonsense going on with it. Bioterrorism. So I talked about this a little bit in class. Okay, people will hold things like polio and other things and use them for biological warfare. Right now, several countries have polio on hand, and they have it for biological warfare. So United States has it, Russia has it. The rejections. You should know the difference between these organ rejections, okay? So with hyperacute, this happens immediately after transplant. Again, this can be because of the cells in your body. If there's not a good HLA match, or that histocompatibility complex doesn't match, that can cause the body to reject it, and that would happen immediately after. So hyperacute is immediately after. Acute would be several weeks later, and then chronic can occur months afterwards. There's also a type of rejection called host versus graft disease. This can happen with kidney transplants, where the host body, okay, or the host immune system rejects it. And we have graft versus host disease, where the graft tissue actually contains T cells that starts to attack the host. So hyperacute rejections, these can happen immediately after the transplant. This is a greater risk in anybody that has pre-existing antibodies, like if they've had previous blood transfusions. You should know the difference between the types of transplants, okay? So allograft is people of the same species, one person to another. Isograft is identical twins. So I for identical twins. Autograft is from one part of your body to another part of your body. And then xenograft would be like if you got pork, pig to human. You have to be careful because anybody that's immunosuppressed is going to be more at risk. Okay. So if they use drugs that cause immunosuppression, cortisol, steroids, they might have some sort of immunodeficiency disorder. They could have AIDS. All these things are going to put them at risk for infections, lack of a spleen. And then your hypersensitivity reactions. Okay. IgE is the one they talk about the most. That's a type 1. That's going to be any sort of allergy to like food, weeds. Type 2. This is cell mediated, cytotoxic. Okay. So here we usually see this in a blood transfusion or erythroblastosis fetalis, where mom has negative blood and the baby has positive. Immune complex is type 3. We'll usually see this with serum sickness, glomerulonephritis, rheumatoid arthritis. And then type 4 is cell mediated. And that's going to be like a delayed reaction. So, like your contact dermatitis, your TB, when we give you the TB underneath the skin to see if you've been exposed. So type 1 is an allergic reaction mostly caused by allergens. Remember that we're going to see IgE. Complications could be anaphylaxis. We're going to see a drop in the blood pressure, a drop in the blood volume because of that histamine, that vasodilator. Anaphylaxis can lead to cardiac arrest. All right, so hay fever, food allergies, atopic dermatitis, asthma. Anaphylaxis, remember, life-threatening. This is a severe hypersensitivity, decrease in blood pressure from that histamine. It can eventually lead to airway obstruction, cardiac arrest. Some other symptoms they're going to have: itching, tingling. A lot of times it'll be right behind their ears or their hands. Coughing, weakness, dizziness. Remember that pressure's dropping, that volume's dropping. Edema, hives, and collapse eventually. You guys have these, so some of those slides you can go through. I want to get through whatever I think you need to know so that you know what to look at, what to read. All right, type 2 cytotoxic hypersensitivity. Again, this is going to be mostly with a blood transfusion. Okay, just remember that part with this. This causes the cells to lyse or break down, so they're going to be destroyed. The breaking down, that's what causes those symptoms like the back pain. Examples of type 2: blood transfusions, rheumatic fever. Type 3, this is a complex, immune complex hypersensitivity. We usually see this with glomerulonephritis, rheumatoid arthritis. Here we have immune complexes being deposited in the tissue. Those are the main things I would remember about that.
Can you repeat that?
So you have these complex deposits in the blood vessels or the tissues. This is mostly going to be like rheumatoid arthritis, glomerulonephritis, type 3 immune complex reaction. So if you remember, immune complex deposits, okay? And again, it's going to break down the cells because of enzymes, chemicals being released there. Type 4 is that delayed hypersensitivity, okay? And this is from the sensitized T cells. So this is like when you put the gloves on, you get the contact dermatitis, or we give you the injection under the skin for the TB. With autoimmune disorders, okay, here your antibodies are going to attack their own cells. So again, the antibodies are forming against the self cells, so we don't have that self tolerance. Examples are systemic lupus erythematosus, Hashimoto's thyroiditis, myasthenia gravis. With systemic lupus erythematosus, this is going to affect all your organs. Classic sign is that butterfly rash. Okay, it affects the heart, the joints. You have chronic inflammation. All right, so joints, the skin, the kidneys, again, deposits. Okay, antigen, antibody deposits into these joints. Swollen, painful joints, butterfly rash, and this they'll have remission, exacerbations. It can affect all the organs in the body. There's your butterfly rash. So here we have a large number. This is how they describe it. I would know this. A large number of circulating autoantibodies. It causes the formation of those immune complexes. They're deposited into the tissue. And that's what's going to damage the organs because of the impairment of that blood supply. If we have necrosis, blood's not getting through. Inflammation can stop the blood from getting through. Immunodeficiency, this is where they lose either part or all of the immune system. Primary is where they have failure, usually from birth, not because of something, but because of how the body's not working. So usually what primary, it comes from the bone marrow production of the stem cells, the thymus. This can be genetic or congenital. So we might see it first in an infant or a child. Secondary is acquired immunodeficiency. And so we lose the immune response because of either some sort of disease, infection, removal of the spleen. Sometimes it can be caused because of cancer or treatment of cancer, damage to the bone marrow, or depression of the bone marrow, steroids, or severe stress. It puts them at risk for development of opportunistic infections, and that's because the normal flora that usually protects us here is now able to invade the body and cause an infection because of the immunosuppression. Normally, the body would not allow that normal flora to infect. But here, because the body is immunosuppressed, that normal flora is actually able to attack the body. Acquired immunodeficiency syndrome, or AIDS. Again, this is where they now can develop chronic infections because their CD4 count is too low. The HIV has destroyed those helper T cells. They lose the immune response. That puts them at a high risk for opportunistic infections and cancer. Kaposi's sarcoma is the cancer. You'll see that with like purplish lesions in the mouth, brownish purple lesions in the mouth and on the skin. The HIV actually attacks the macrophages and the central nervous system cells, and the virus invades and multiplies in the lymph tissue, the lymph nodes, the tonsils, and the spleen. And it uses those tissues as a reservoir to continue to infect. All right, so the difference is with HIV, they have the virus, but there's no immunosuppression. With AIDS, they have marked clinical symptoms. Again, their CD4 count is going to be usually below 200. They're at risk for opportunistic infections. It's considered HIV itself is considered a retrovirus. They have two strains, HIV-1 and HIV-2, with HIV-1 being more popular in the United States. It's transmitted through body fluids, blood, semen, vaginal fluids. The signs and symptoms: lymphadenopathy, fatigue, headache, arthralgia, GI issues, mostly due to those opportunistic infections. Encephalopathy, so this is where they develop what we call AIDS dementia, and you have the brain cells are directly infected by the HIV itself. Again, most of the time, it's those pneumonias, those opportunistic infections that they're going to end up expiring from. And then the pneumocystis carinii, which we talked about yesterday. I talked about that being one of the main ones. Also, they'll develop herpes simplex, cold sores, those fungal infections, candidas, thrush that can involve the mouth and the esophagus. And now we're seeing a rise in TB in these clients. And actually, there's also a rise in all cancers in your AIDS victims. So again, Kaposi sarcoma, that's going to affect the skin, the mucous membranes, the internal organs, and non-Hodgkin's lymphoma. The purple or brown non-porotic painless patches, that goes with the Kaposi's. All right, guys, that's it for immunity. I really wanted to cover that one heavy because I feel like you really need to know that more than skin. I mean, you are going to have to know skin, okay? But I'm not going to be able to get to it right now. I can offer to come on a little bit earlier tomorrow if you want me to cover skin before I do the review. I can offer
Yes,
to do
please.
that.
Mm-hmm.
Okay. So if you guys are on here and you want me to do the skin, then jump on at 8:30 tomorrow.
Thank
Okay.
you.
Thank you.
We will
Okay,
cover the
thank you.
skin. Okay.
Thank you.
Thank you.
All right.
Thank
Spread the
you.
word to your classmates so they know.
All right.
Okay.
All
Then,
right. Thank
I
you.
gotta run to the shore, but when I get back, I'll try to upload this video.
Okay.
Thank you, Miss Roche. Have a good one.
You.
All right. Take care.
And